aso abai wo se wontua ne ka aha eno de dabi emfa the amana se fa kwa strike no mo fa document ne to so ne akwa anim tantam and as me to delay pa asemato fa document ne to so mo kwa ba bia packages ne wo no enyema miensa ena nasefo a wo makwa strike wo mo eko ho enyema wo mo ne aban edi ho nkoma no ensiye no eninie na mekan ade na ankasa kra no enkofo be interesting ti no mo yesa that one now come on it proper
midwifery the for penyini ono na a set up sa strike we owie no no call Finland we ja hokọ Finland o ye den a o kwa akopɛ position bi ewo some foreign den organization munti we ja o set up strike ni wie no o ka kire nurse for nyina so mo nko edwuma no owie no free Ghana or Finland
na sam ne wo document na midwifery dey nurse for any akufo ado aban ekoya agreement anyone sasha ase no me pa chawo or say the effective date of implementation me pa chawo one for May and one for wool or the shall not just say I was saying 1st July 2024 and as strike we ya nurse for yakoi and I was akwaboko
ono e leader no ono mo ye meeting wie no and activate strike no and fum okoshe Finland or compare position. The question is, nurse for strike no makono edie na omo pe.
And for KevinTaylor, any Titi about expose the woman and also the president behind Ghana nurses and midwife a year striker air course currently. Now this woman goes by name Perpetua Oforiwa Ampofu. Now KevinTaylor ababe bonidin in fact openly wababe bon ma minidin echeche mu se MPP for use mami way e the year politics now we share from the demands and nurses no e demande any nipo strike nechi the president behind the Ghana Nurses and Midwife Association o issue strike ni we fi Ghana eko Finland na in some no chichaso now finally Titi any KevinTaylor in Sembia Betuja. Out of all, almost say the NPP is behind this or more use this as an agenda against President Mahama. Now, dear, you ain't say one KevinTaylor, any Titi, or the two Jawa and their supplement, and you feed agro, YNT, and fire them, and famra.
But to me, as well, I was a Wuntianica. Aha, I know dear Debbie. Emfa. The amana se fa kwa strike no mo fa document ne to so ne akwa anim tantam and as me to delay pa asemato fa document ne to so mo kwa ba bia packages ne wo no enyema miensa ena nurse fo a wo makwa strike wo mo eko ho enyema wo mo ne aban edi ho nkoma no ensiye no eninie na mekan ade na ankasa kra no enkofo be interesting ti no mo yesa that one now come on it proper book and research allowance. Was the government approved rates to apply per year? Beneficiaries are to publish their research findings and apply same to teaching and learning. And nursing tutors with PhD and master's research in degree awarding public health sector institutions. Uniform allowance and Tadiana and that's a foreshadowing. Uniform allowance. Payment of 1,000 Ghana cedis per year. All nurses and midwives in the public sector. Because any allowance no mukuhuni na and a year midwife and nurse for the qualify for it. A bill where executive media and a bill where Bakupa Mekayano uniform no and a combo munina. Niataso a full allowance. 180 liters at the rate of 10 cedi 99 pesos or at the applicable government approved S pump rate, whichever is higher. Principal nursing, midwifery officers in the public sector and above. Enti categories and you'll be upon the qualify for allowance no more kono. Enti perpetual now was sorry our quatina Finland no. Ono or fighting for the interest because for no benyabi. Book and research allowance no benyabi. Nancy for na makwa strike no. Munti adiana mo ya na siansa. Adiana mo ku hono kwa no fa kasia na kwa executive no ho. Na mo misa mo ho say eya eko papa ekwama mu nyina eka de omo ye no won be ya na hwa ade bi wo ho ne ye Ghana fo a yenti ye ho asese ye yo man wow anope de ama me buafu wa asem we hu ne say Perpetual is a politician. Sa ayi midwife for former president no oya politician oya MPP ni ani ni kunu na busuafo nyina ya MPP for. We know that for a fact. When any breaking news, and you mean I mean breaking news with Yama, or be an himself perpetual young people. No kuna young people ni. Nabusa for na young people ni. Me and family ho. So we young people no, and no yamasam. But the yamasam is with the political interest. Epas will frustrate the whole system.
We just hoko Finland. Or there, or kwa position B. Ewo some foreign aid organization winti. We just or set up strike ni wie no or catch a nurse for nyina so mo nkwadwuma no o wie no free Ghana or Finland. Mrs. Perpetual Oforian Pofo has been elected as the African region representative for the International Council of Nurses ICN board at the Council of National Representatives meeting and ICN Congress ongoing in Helsinki, Finland. Ono e leader no ono mo ye meeting wie no and or activate strike no and whom or Finland or compare position. The question is, nurse for strike no makono edie na omo pe edie no mubusa buying 2024 and a nurse for more Ghana satana MPP are buying and a power and a omone abine ko shiaye 2024 May nurse for ne abine ko shiaye no and omo ka kira abine say omo hia nyom bia wo say abine no eyema omo ko shiaye no de epia mu nie 2024 no they called something the 2024 collective agreement international for any MPP aban all the way in May 2024 etnase nurse for no the nyoma bi eto ekufuado aban nanim. Now the 2024 collective agreement for nurses and midwives in Ghana signed in May 2024 outlined improved conditions of service including salaries, allowances and benefits. Inti omuni aban ekufuado aban ni share no May 2024 no that means May June July August September October November December be 7 to 8 months near atuaba it's not time wom and aban ni omotena ase now nyoma omotena ase a omode to aban ni se aban ni nyema omo no enie and kai se sa nyoma na na ende ama nurse for we akọ strike inti nurse for no strike na omakọ ne ende no enye nde ya na omubusa ho asemo e under MPP aban no more 8 months to elections omuni omotena say agreement said yen say sanyoma we de yagiatum na yebeye 1 13th month salary an additional salary annually as a bonus nurse for in 2024 May omuni aban tena say kufuado aban ba obi aban tena se no omuka say afibia no e wo say samo mo bosome ba akoka ho aketua free intinka December bia no also mo aketua mienu 13th month salary. 2 fuel allowance no say support for professional engaged in travel or outreach services, which this one I agree. No say nurse for yes small mo be a nurse wo Ashanti region so onko sirem na onko di dwuma bi na onko di dwuma bi almost no mo hia fuel allowance, which I agree. The first one I don't really agree with it. Say your mom 13th month salary, I don't agree with that. Because and the government agency, a buying institution, be able to say a man 13th month salary, which I don't agree. 3, medical allowance, subsidies for healthcare costs for personnel and their families. This I don't agree. Nurse for the demand did say, I was say a buying health insurance, a buying sebio etisokra momo any omobusia for. Anything and the nurse for a cost strike, These were some of the demands they were demanding from the government. And Nana Danko Kufuado, Bawumia in 2024 May, they agreed. So because now elections eba. Now do you understand? The other demand or demand here, rural incentive allowance, extra pay for those serving in remote areas. I agree. Omo asebi omo to mu wesi wo say, omo person ko tena nkurase, no mo ye de nurse adwuma, e wo say aban to me mo some special allowance, which I agree. I agree. And omo buy uniform allowance, which I don't agree. Omo diane say annual support to maintain professional dress standards. Omo say aban ensa emo allowance on beto uniform. Ase omo twitwa soma na skirt. Na omo look professional. I don't agree with that. You are a professional. You are being paid. You should be able to get your own uniform. How much is uniform? License renewal support. I'm going to say employer-sponsored professional license renewal. I'm going to say abain. Your friend be a professional license renewal. Abain, license, no. Abain sound support no renew more. But you are a professional nurse. These demands are like you are in school. I just say, munina more nursing school. Majority of your demands, I just say more nursing school. They want the government to sponsor or help them with their license renewal. No. This shouldn't be a reason why nurses are at home. Now, I'm going to say, workload management measures, structured protocols to balance nurse workload. I agree. In fact, those things are very important. And it's people like us, say, nurse for the bina Abai should find a way to employ those nurses because we need more nurses. Because under ura kolebu ura konfonocha, utmi one nurse na a patient bear 100 and so that's not right. So we need to expand the employment bracket. More people will be employed. Stress, we will get a balance. Pressure and better nurse for so now you one nurse are all treating 50 patients. Continuous professional development, financial support for training. It's very good. When you work at a point, you need to open your horizon, expand your horizon, freshen your memory, and also learn different things. If you want the government to support you in training, enhancing your skill, it is very, very important. And I support this. The government should help nurses who are willing to expand their horizon, expand the training they have gotten. There will be health and safety protocols, improve workplace safety measures. This is not part of a demand. I don't agree with this. Health and safety protocols, internal, administrative. Every hospital, the person who is the head of that hospital has to make sure those things are done. These are not demands. Something like health and safety protocols. That's why we have CEOs of hospitals. That's why we have departmental heads. It is their job. In the hospital, budgeter, they know, say, about health and safety protocols. These are internal things that has to be taken care of. This is not something you go to the government and say, health and safety protocols is not being done well, so we are going on strike. Because of health and because that is why every hospital, your management, we have people who manage the hospital. Those are not things you need to go to a government and demand. These are things that are supposed to be done internally, administratively. Now, do you know what's appalling about this whole thing? After May now, 2024, in fact, and in August 2024, these same nurses wrote to the government, Ekufuado's government. This is in August 2024, 28th August 2024. To remind the MPP government to say, we had an agreement. You said you were going to provide these things. Why haven't you done it? So after May meeting August, the nurses wrote back to them and said, we are reminding you, demand for implementation of the collective agreement of the Ghana Registered Nurses and Midwives Association. So they wrote back and they demanded, what is going on? We spoke. There was an agreement. May. We are in August under MPP, under Ekufuado. They didn't even listen to them. And that is the letter. We bring you warm greetings from the National Council of the Ghana Registered Nurses and Midwives Association and write to demand for the expedited implementation of the collective agreement between the GRNMA and the Ministry of Health and its agencies. Into omo remind MPP abino. May I didn't count one seven and August. Monka wushiu. Satan Okoboy na minister. He saw it. Okoboy was the minister. The nurses met and came back again to remind the MPP government. Because they were doing politics with it. Because the leader, MPP ni, so they were doing politics. And politics. In two kind of the GRNMA collective agreement was signed on 20th May 2024